Hello, and welcome to another exciting edition of Synlab podcast. My name is Uchenna Amadi, and I'll be your host. Today, I will be doing an exclusive on the topic genetics and the heart, the future of cardiovascular care. And I'll be doing this with Dr. Ikem Udu, a senior clinical coordinator and cardiovascular specialist at Lagos Executive Cardiovascular Center. It's a pleasure to have you here.
Thank you.
Please do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. Before we start this gist, I would like to formally introduce our esteemed guest by reading his bio. Once again, please meet Dr. Udu Ikem G, MD, Senior Clinical Coordinator and Cardiovascular Specialist at Lagos Executive Cardiovascular Center. It's a pleasure to have you here once again. So it says here that Dr. Udu is a highly regarded cardiologist with expertise in managing complex cardiovascular conditions such as refractory hypertension, advanced heart failure, and cardiac rhythm disorders. A graduate of Nnamdi Azikiwe University, he combines diagnostic precision with evidence-based care at Lagos Executive Cardiovascular Center and Chiron Hospitals. As a senior clinical coordinator, Dr. Udu has led initiatives that improved patient outcomes through integrated care pathways and standardized protocols. His research has shaped regional understanding of hypertension and heart failure, particularly among young adults. Wow, that's interesting. And he has contributed to continent-wide cardiovascular guidelines through Pan-African collaborations. A frequent speaker at medical conferences, Dr. Udu is known for making complex cardiac topics accessible to both peers and the public. He is actively involved in professional cardiology associations and passionate about preventive care in cardiometabolic health. Outside medicine, Dr. Udu is a competitive badminton player. Wow, I will come back to this. And music enthusiast. Embracing a holistic view of health that blends physical, emotional, and creative well-being. His physiology centers on seeing beyond the heart as an organ to understanding the whole person. In his words, true cardiovascular health requires addressing not just physiological factors, but the complete spectrum of influences on a patient's well-being. Wow, wow, and wow. It's a pleasure to have you here, Dr. Udu.
Pleasure to be here.
Let's go back to the badminton. Why badminton?
Okay, yeah. Growing up as a child, I used to join the football team, but then I was bullied out of the football team. So on this fateful day, I was just at the fringes of the pitch, and I saw a group of boys playing badminton. So they asked me to help them pick the racket or hold the racket. I was just the racket holder that day. So as I was holding the racket, one of them got injured, and I was just compelled to enter the badminton pitch. Wow. And while playing, I felt maybe football should take the back burner. And that's how I started. And from there, I picked a lot of interest. And it's really enriching.
And you said competitive, so any medals?
Yeah, I had a medal back then in secondary school.
Oh wow!
I didn't want to play because I knew I was going to defeat the person. So the opponent begged me not to play.
Pride.
The opponent begged me not to play, because they were the defending champions. So they wanted me not to play, so they would retain the trophy. But then I just wanted to show myself, sort of. So
show myself, okay.
I did, nice. and I won. obviously.
Like,
There's no
there's
there's no
problem.
pride about it, but I just love badminton. It's something that makes me very, very fulfilled.
Nice.
Yeah, football is a very popular game amongst boys, but I feel there are still other games that are much more important than football.
Yeah, and
Agree with your
I
key
can get the
parts.
relationship between the badminton and the whole cardiac thing. You know, we're talking about the cardiac today. Yeah.
Yeah, at that point, I didn't think about it
Of course.
until I had to do with cardiology, but
That's nice.
there's a sync now.
That's nice. Thank you very much. Once again, it's nice to have you here. So do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. Now we are entering the crux of the matter. Let's start the gist because I can't wait to unravel what we have for you today. So, Dr. Udu, what exactly are cardiovascular genetic markers and how do they influence the heart health?
Okay, yeah. Thank you very much. I love this topic a lot because it has to do with a lot of young people. Through my practice in cardiology, I've come to see a lot of young people who are very, very disturbed about their diagnosis of hypertension and cardiovascular diseases. I feel for them. Okay, at some point, I didn't used to have any form of emotion because I mean, as a doctor, somehow you are trained to be numbed. You see a dead body, and then the next moment, okay, you lose a patient. The next moment, you are moving over to congratulate someone who was just put to bed.
Oh, wow.
So there's just a mix of emotions. So you are trained not to be emotional. So I was really numb. I didn't have any flare of emotions until I had a very bosom friend who was diagnosed of hypertension. So he was asking me how did it happen, how come, how, why him, all those questions. So I became really concerned because it affected me directly. And that was one. Then my elder brother was also diagnosed of hypertension in another hospital. I was like, how, why? And this is me. I'm not hypertensive. There is no cardiovascular disease in me. I mean, I work with the cardiology specialist. I'm in the cardiology field, but then I had this concern, and I saw it as a state of emergency to, I mean, address the challenge in these younger people, addressing why they would come down with hypertension because it was a lot of concern from their end. So the reason I picked interest in the genetic topic is because most of them sought to get answers to their questions. And the answer to their question is finding the genetic component of these cardiovascular diseases, because most cardiovascular diseases are not incumbent on people because of what they eat or their lifestyle. It's purely genetic. And if your father or your mom has had a cardiovascular disease, there is a high chance you're going to have it yourself as a young person, irrespective of your age. There are people who are 20, 21, 22, coming down with hypertension and other cardiovascular diseases. It's not their making. It's just genetics. Because it's just like paternity test, people having to do DNA tests to know if their child or their children belong to them. That's how genetic testing can be. You need to find out what actually caused this this cardiovascular disease. In terms of hypertension, if you do a genetic testing, you could find out the risk of having it in, say, 10 to 20 years without getting so surprised whenever you're diagnosed. So that's the tone of the genetic testing for cardiovascular disease. That's what it's all about. It's just about finding the stuff in the gene. The gene is a very complex stuff. I don't want to go into that detail because most people will not understand. But the gene is just like a blueprint, for your health. Now, there are a lot of blueprints for people who have sickle cell. They do their genotype and all. That is for the sickle cell. But when talking about cardiovascular health, the blueprint is different in the sense that it's not popular. It's not over the place like we have in sickle cell and the rest. That's why we need to popularize these things so that people get to know that they can actually test their genes to find out if they are predisposed to having cardiovascular diseases and all. So that's the tone of genetic testing in cardiovascular health.
Okay. So in simple terms, Can you explain how these genetic markers differ from the traditional risk factors like the blood pressure or your cholesterol levels? How do they differ?
Okay, well, I would like to think of the cholesterol and the blood pressure as forecasts, and then
Okay.
the genetic testing or genetic markers as climate, because the blood pressure and the cholesterol levels, they help to forecast, they predict if you could have the genetic
So
the
you have to monitor
cardiovascular
them
diseases. Yeah,
often.
exactly. But then the genetic markers, though they can be, they just tell you the possibility of having cardiovascular diseases, but they are not quite certain. But then it gives you that inkling to be very, very steadfast in
Oh,
the
wow.
things you eat,
Yeah.
your lifestyle, how you can modify. If probably you take a lot of carbs as a lady or as a young person, you cut down because you know that your risk of developing cardiovascular disease is very imminent, and you just have to avert it by cutting down on a lot of lifestyles. See, I know out there, many people will be wondering why they still have all sorts of cardiovascular diseases like hypertension, heart failure, and the rest, even without having to default in terms of their dieting and their exercising health. But then I want to bring you a good bad news. The good news is that there is a way out, which is through genetic testing. You can find out the answer to your questions, which is that genetics have a lot of role to play in you coming out with cardiovascular diseases. And the bad news is that most times it cannot be undone. You just have to know your risk and then work towards adverting it in the future. That's a good bad news. Yeah.
Oh, wow. Okay, now speaking about these genetic markers, how does identifying a genetic predisposition change your approach to treatment or prevention?
Okay. In terms of treatment is just, let me say, it's going to be like having something. Okay, you're traveling to Lagos, and you know that your car is going to spoil. You went to the mechanic workshop, say, a week ago, and you're told that your car is going to spoil, and then you did not take any precautions. You went on the journey, and then along, or maybe you're traveling from the east to Lagos, along or your car broke down and spoiled. It's not like you did not know that your car was going to spoil. You could find a mechanic to fix the car there, but then there is a way you would have averted it by probably asking the mechanic what could be done before you set out on the trip. So the treatment is always not even necessary for me. What matters most is the prevention
Catching
and
it early.
catching it early. That's where the genetic testing comes in. Because if you catch it early, in fact, you don't even need to test most times. Let's say your father or your mother or your grandparents had cardiovascular diseases. Nobody should remind you to go to the hospital to go test or to go screen to know if you are at risk of having it as well. Because most times, even the treatments are defaulted by most people who come down with the cardiovascular diseases. Yes, most doctors don't like medication. They don't like drugs, but then they prescribe it for other people. Yeah, that's a truth. Me, I don't like taking drugs. I rather do the whole lifestyle thing than take medications. But when it is necessary, don't get me wrong, when it is necessary, I take the
Before they will say,
medications.
Doctor Udu said he does not take drugs, so I will
Please
not
don't
also take
don't
drugs.
quote me. So I know when most young people come down with these cardiovascular diseases, they would have to go on medications for the rest of their life. It's very unfortunate. So that's why I don't like emphasizing on the treatment, because they will not even stick to the medications. They just take it once or twice and tell you that they're done, that it's not their portion. They can't do this. Like, it makes them
Religion.
feel
It's
old.
not their portion.
It makes them feel old that they can't continue taking this medication. So emphasis should be drawn or taken more to the preventive aspects than the treatment aspects, because the treatment is really failing because there is little adherence.
Okay, so looking at your bio again, your research shaped regional understanding of hypertension and heart failure, particularly among young adults. Now, it got me wondering, what age are we talking about? At what age should somebody consider undergoing genetic testing for a heart disease risk?
Yeah, that's really important as well, because now the WHO has defined young adults as ages 18 to 29. And in cardiovascular health, young adulthood transcends beyond that. It could even go as low as 15.
That's scary.
It's very, very scary. I don't intend scaring
That's
my
a secondary
audience.
school child.
Yeah.
SS1,
So
SS2.
it can go as low as that, 15. That's
Wow.
the bad part of it. So that's why I took a lot of interest in this, because a lot of innocent people who don't even know anything
That are
about
just living
their
their
health,
lives.
trying to be young and free, young and free. They just come down with these conditions unannounced. So the essence of the research is to nip this menace in the bud, to nip it in the bud, so that people can have their lives. It's not that it's going to eradicate the cardiovascular diseases like heart failure, hypertension entirely, but it's going to give people a sense of awareness, one, and it's going to help them prevent it from even starting early. They could have it at 70. In fact, the Bible said at 70 you can die, and you must have lived your life. Yeah, but then it's not like they should die at 70. But then if they live up to 70, it's something. It's a good thing. They must have been very, very fulfilled and achieved some purpose in life. So the reason for the interest in young people and this genetic health is that it keeps them informed about their health, and it saves them from a lot of things they should have been saved from. Okay, now, just like someone in secondary school in SS3 trying to apply for JAM to enter the university. Now, most people or most parents guide their children to a particular course, say medicine, engineering, what's it called?
Law.
Nursing, all these professional courses, law. Thank you. So I have a friend who said that he will never forgive his parents for allowing him to study fishery.
What?
Yes, that he will never forgive his parents for allowing him to study fishery. The other one was zoology. He studied zoology. He said he won't forgive his parents. I don't blame them. It's not like zoology or fishery is a very bad course. But then he said that he just wasted 4 years in school. I don't know why he said that, but it could be about the course or it could be about he himself. What I'm trying to say is that if we don't save these young ones when they don't have so much information about their cardiovascular health, when they come of age, they might not forgive us. So we need to save them now, so that when they come to the full understanding of what we did for them, they will be very grateful and we must have helped the generation.
Yeah,
so that's why we're doing that.
Okay, so I know you mentioned something about if your parents or your grandparents had it, then you should. I know you've talked on it, but I'd like you to dive in deeper. Tell us the role the family history play in prompting cardiovascular genetic testing.
Okay, family history has a lot of role to play. Family history, because
I think it has a lot of roles to play in everything you're doing. Once you get to the hospital,
I'm telling you, they must ask you if your father has had it or if your mother has had it. Anybody in your family, they ask that. In fact, some patients don't even want to answer again because they're tired of answering.
More like write it when I come, pull up my data and check.
So it's a recurrent decimal in the hospital. You keep asking that, not because we want to ask or we're interested in your family.
That's
or we're a village people chasing after you. We're not interested in that. Just carry your family while I go.
That's not nice.
So the great question is this: what is that thing in the gene that is responsible for the transmission from one generation to the other? Now, the gene codes a lot of information, just like in programming. When they do a lot of coding, and those codings translate to how the computer or the system functions. So the codings are the set of instructions that guide the system on how to function. So the genes have a code as well, known as the genetic code. The codes are written in very complex languages known as amino acids. That's a series of codes that code for the transmission from one generation to the other. So these codes undergo some mutations, just like programming errors. Programming errors could happen, and then the system could malfunction, or there could be a virus in the system, and then there could be a malfunction. So that same way, the genetic code could undergo some mutations as well. And then when it undergoes the mutation, it keeps producing the effects of that mutated code or gene. So medically speaking, the genetic code has a lot of discrepancies in various families.
Okay.
Various families have codings for a normal, how do I put it? Okay, let me make it very simple. Now, you should think of this as having a water board. And then from the water board, water goes through various channels to get to various houses.
Sure.
It's in a particular state.
Yeah.
Now, at the water board, there are various reservoirs that transmit water through pipelines.
Okay.
Let's say someone managing a particular reservoir was asleep, and then all of a sudden, he mistakenly, or he was very drunk, and he mistakenly poured a substance, a discoloring substance, say something like jig or a substance that changes the color of the water.
Yeah.
Definitely the water that goes through the pipe to every household from that reservoir is going to get that particular color of substance that was put inside that water.
Sure.
Now, for other people who their manager or reservoir keeper weren't drunk and probably didn't put any substance in the water, will still have clean water. So it is individualized in the sense that different codes come with different mutations. So that ink or the substance the person must have poured in the water is the mutation that must have happened with that particular code. So it is individualized. For the fact my family doesn't have hypertension doesn't mean that your family shouldn't have. And if your family does, you shouldn't question why they do. Because most times
why you put it like that?
It's I don't want to sound rude, but it should also inform us. It also makes us understand that science, nature, and the divine are intertwined. Science, nature, and divine. God still has a lot of role to play in all of this. And it doesn't make God a wicked person. Because most persons have questioned God a lot of times when they come to the hospital. Why God go leave this person, come put this thing for my family? So that person, that God should have put it in their family, so they deserve it. I don't understand.
Yeah.
So you get, but in all of this, we can't question God. And in as much as all those things have been put there, whether by God or nature or anything, God has also devised the means through cardiology to address some of these challenges. So we are not left empty-handed.
I particularly love what you just said. Yeah. Thanks for doing justice to that question. So you see that family history plays a huge role in cardiovascular genetic testing. Now, moving on, let's talk about misconceptions. Okay. What misconceptions do patients or even other doctors have about the usefulness of genetic testing in cardiology?
Okay. Now, the misconception the key misconception is that once you do your genetic testing, that it's certain you're going to come down with cardiovascular health or cardiovascular diseases. The misconception is that it is only a possibility, but not a certainty. It just tells us the risk. It doesn't mean that you have it. There's a difference between risk factor and causology. Cause is that this thing makes this thing happen. Risk factor is that this thing can predispose. And that leads me to the next thing I want to say about environmental factors. Now, no matter how genetically predisposed someone is to not having a condition, let's say in your family line, you're not predisposed to having cardiovascular diseases. and you are the type of person that eats a whole lot of junks, you take a lot of carbs, you don't even mind.
It's waiting for you.
It is waiting for you, whether it is your family or not. So environmental factors have a lot of role to play as well, in as much as we're emphasizing the genetic one, because the genetic one has been relegated to the background a lot. That's why we regurgitated it. But then environmental factors are really, really strong. They drive these genetic changes a lot. And without the environmental factors, we might not even be talking about the genetic factors, because most times the genetic factors are just on their own. Now you go weak dead body. You want to just trigger it with your lifestyle and your bad behavior.
Problem, they sleep.
You understand? So that's why we also need to carry both of them pari passu, because most people, the misconception is that one, it is not a certainty, it is only a possibility. Number two is that most people disregard the synergy between the two, genetic and the environmental factors. And then number three is that most people want to major on only attending to the environmental factors. Yeah, I've seen a lot of patients come to the hospital. They were properly diagnosed of hypertension. And then they said they went to seek a second opinion in another hospital. And then they went there. The doctor told them, probably the doctor is a cardiologist. I mean, it might not be their fault. Doctor told them that they should just work on the things they eat, that they should stop their medications. Like, I mean, who does that? I think also some of the health professionals need to help us in this regard, because you make it look like the other hospital has told them a lie.
Yeah.
Or they will just want to put them on medications, probably to make money or something. How much are we even making from your medications? You don't even come to buy them regularly. So you need to...
Shots fired.
You need to make a distinction between people who want to deceive you and people who are telling you the truth. Because, I mean...
Spirit of discernment.
Do you understand? I mean, not everybody has that. But you should listen to those who might have that. So... nobody's going to mislead you about having hypertension if you don't have it. So there are rules and there are ways to ethically make a diagnosis of hypertension. And when a cardiologist says you do, I mean, I think you do. He might not be God, but God is using him.
Nice. Another punchline. Okay, so let's talk about clinical signs.
Okay.
What are the key clinical signs or patient scenarios that should prompt a doctor to consider genetic testing?
Okay. Very good question, because that's the crux of the matter. That is why we started talking about the genetic testing thingy in the first place. So it has to do with the family again. If in your family,
the history.
Yes, family history. If your parents, probably your siblings or anybody in your family have heart failure, hypertension. You know, there's this particular cardiovascular disease that is rarely talked about. Okay, they say, for instance, they tell you that someone was playing football, a young person was playing football in the field and suddenly slumped and died. That is not hypertension. That is not heart failure. It is called, in medical terms, hypertrophic cardiomyopathy. That's one of the major causes of people just slumping. Sudden cardiac death. They just collapse. And then next in the rush to the hospital before they got there is brought in their BID. So that's not so talked about. And there's a genetic predisposition to that, because I have a lot of patients who were brought in dead because of the hypertrophic cardiomyopathy, and they were only discovered when they had already died. I mean, what's the usefulness of doing that? It's not going to help the it's not going to help the patient at that point. So we would have done all those when the person was alive. So in view of this particular one, genetic testing really needs to take take precedence in all we do in cardiology or health-wise. Then secondly, I talked about this initially, young people come into the hospital and then they come in happy, you tell them they have hypertension, they go home sad. I mean, it's a thing to be sad about, but
it's not a death sentence.
It's not a death sentence, but it shouldn't have been surprising, or it shouldn't make them sad if they had done a genetic testing to know that they could come down with hypertension later in the future. So when you tell them at that point, they'll be like, oh, I think I know I might come down with this hypertension, or heart failure or cardiovascular disease. So they won't be surprised at that point. So genetic testing helps us to reduce the shock that comes with the news. One, it also helps us to address the issues of people dying prematurely or dying at a very young age when they're still in their prime. And thirdly, it helps us to address the issue of how do I put it? Of not knowing when to start taking proper measures about your cardiovascular health in general. Yeah.
Okay. I also want to know, because I'm very curious, how do you determine which genetic tests are appropriate for different types of patients?
Okay. Let's say Mrs. Uju comes to the hospital and then she tells you that, hope nobody's Uju.
It's not your own, no. Mrs. Uju is not your own.
So let's say she comes to the hospital and then tells you that her elder sister was diagnosed of hypercholesterolemia. It means having a lot of cholesterol or body fat. So the first thing you need to tell her is first thing you need to do as a form of genetic testing is to check her risk of having hypercholesterolemia herself. That is still boiling down to family history. Or say she comes in, the same Mrs. Suju, tells you that the dad was diagnosed of hypertension about 5 years back, or the dad has a myocardial infarction. You also need to screen her. You could use cardiac biomarkers like the troponin, CKMB. You could also screen to know her own risk of having such cardiovascular disease. In general, there is no particular age to start. Okay, I've answered this question, but I want to bring it back. There is no particular age specified or mapped out for starting the screening. The screening is individualized. If someone in your family had the cardiovascular disease at an earlier age, you should start screening earlier. If the person had it at a later age, not that you should start screening later, but you should start screening, let's say, early 20s or late 20s. But then if someone in your family had it at the age of 25, you shouldn't wait to 25 to start screening. Come on. What if it hits you before 25?
Yeah.
So you should start, say, 15 or even 20.
So that 15 you mentioned earlier is actually safe.
So you should start earlier. So talking about the particular genetic testing for various conditions, yes, there are various genetic testing components for various cardiovascular diseases. I mentioned that of genotyping for sickle cell and paternity test for DNA for paternity test, those ones are common. But then we don't have the cardiovascular genetic testing commonly readily available in our climate. That is why we are advocating for this, because even if someone comes to the hospital and you want to recommend a genetic testing for a cardiovascular condition, where will the person do it in Nigeria? Unless the person flies out. So I know big laboratories in Nigeria can stand up to this challenge and start it, and people will be ready to patronize them to do these genetic testings because it helps prevent a lot. And in fact, for the fact that people take a lot of medications, it can also be reduced by genetic testing, because genetic testing would also help us to tell you that this medication is good for you, this one is not good for you, this one has some form of you have allergies to this medication. Yeah, allergies could be subjective though, but then before you even react to the drug and want to bring it back to the hospital, we must have told you that you shouldn't take so medication that it causes allergies. For it has some tendencies to cause allergies for you. So wouldn't want to recommend that. So it has a lot of roles. Genetic testing is so all encompassing, and I can't even wait for Nigeria to fully entrench it in her laboratory schemes.
Wow. Thank you very much, Dr. Udu. This has been a very interesting discussion. I was particularly, shocked when I heard 15 years. That's actually scary. Yeah. So it means that genetic testing for your cardiovascular system should start as early as possible. I loved when he said, if somebody in your family had it at 25, you shouldn't wait to be 25 to start it.
Exactly.
And time again in this podcast, we've been talking about environmental factors. What you take in can make or mar you, can make or mar your heart. So let's be mindful about our environmental factors. Please do not forget to like, subscribe, share, and follow Synlab Nigeria on YouTube and on Spotify. Stay tuned. We'll be right back with the continuation of this edition. Thank you.